How are you?
So nice to see you guys.
Hi.
Hi, my name is Devon Paciello. I'm an occupational therapist here with the Valley Health System.
My name is Justine Sendecki, and I'm a physical therapist here at Valley.
My name is Stephanie Ambrogio, and I'm a speech pathologist at Valley. We have a couple questions from our community, so let's get started. The first question is, what is the difference between inpatient rehabilitation and outpatient therapy?
So with inpatient rehabilitation, work focuses in the acute level in the hospital setting. It varies depending on which service you're receiving, whether it's OT, PT, or speech. Regarding occupational therapy, we tend to focus more on what's called activities of daily living, so being able to dress yourself, shower. Also, we work on fine motor and general conditioning.
For physical therapy, we work on functional mobility, such as bed mobility, walking if that's appropriate, transfers like getting in and out of a chair, in and out of the car, also seeing if the patient needs an assistive device like crutches, a cane, or a walker.
At the inpatient level, speech pathology focuses primarily on swallowing and the safety of your swallow. We have the ability to perform x-rays, which are called modified barium swallow studies. We also focus on communication, cognition, and memory, and we focus on speaking valves for patients who have recently received a tracheostomy.
In the outpatient setting, again, depending on the service you are receiving, the treatment varies, but we do carry over what you were working on in the hospital, and it's all focused on patient-centered goals.
For outpatient physical therapy, and I'm sure for OT and speech as well, we work on short and long-term goals so that the patient can be independent in their community. Next question. What types of outpatient rehabilitation therapy does Valley provide to the community?
Speech therapy provides an array of different types of approaches. For swallowing, we have different approaches such as the McNeil Dysphagia Therapy Program. We also are certified in Vital Stim as well. And we also have different approaches for typical dysphagia therapy where we will utilize biofeedback to help motivate the patients with that biofeedback. We are certified in Lee Silverman voice treatment for patients who have Parkinson's disease, and we also will focus on dysarthria or motor speech therapy, voice therapy, as well as cognitive and language therapy as well.
The occupational therapists at Valley have received advanced certifications in upper extremity and lower extremity lymphedema therapy, certified hand therapy, vision therapy, and LSVT-BIG for Parkinson's. Along with that, the occupational therapists treat a wide variety of conditions related to oncology, neurology, and orthopedic.
Similarly, for physical therapy, we treat a variety of conditions. For example, we have therapists certified in LSVT-BIG for those with Parkinson's, pelvic floor physical therapy, aquatic physical therapy, as well as advanced orthopedic physical therapy that can include treatment for knees, hips, shoulders.
Next question. What type of health issues are treated in the outpatient setting?
The different types of health issues that speech therapy treats at the outpatient level can consist of difficulties with memory or cognition, difficulties with communication, such as language, your expressive language or receptive language, difficulties with swallowing, eating, and drinking safely, voice therapy, as well as dysarthria therapy to target motor speech and the ability to communicate clearly.
For outpatient physical therapy, we treat a variety of conditions for those patients who are lower level and higher level as well. We treat different orthopedic conditions such as neck, low back pain, hip and knee pain. We treat those who are post-stroke and also have therapists that specialize in balance therapies for patients who may be a fall risk. Additionally, we do have therapists who specialize in pelvic floor treatment that can include women who are postpartum.
With occupational therapy, we treat a wide variety of patients. Regarding orthopedics, we are generally focused on treating the upper extremity, so this can include rotator cuff pathology, carpal tunnel, tendinitis in the elbow, shoulder, or hand, and much more. Regarding our neurological patients, we tend to see a lot of patients who are post-stroke. We also treat patients with multiple sclerosis, traumatic brain injury, and much more. Again, we also do treat a wide variety of oncology patients at this time.
How does outpatient therapy work?
So first, what a patient would do is follow up with their referring physician or their primary care physician and receive a script that will either indicate physical, occupational, or speech therapy. From then, the patient has a one-on-one evaluation with the respective therapist where we go over outcome measures, goals that are important to the patient, and different standardized tests that can help us figure out what the primary issue is. We also set long and short-term goals to get the patient more independent in their community. From there, we can think about how many treatments per week. For physical therapy, oftentimes it can be 2 to 3 times a week for 4 to 6 weeks.
Similar with occupational therapy, it's the same format for a first-time evaluation. One thing we do is with our treatment plans, we base it off of that evaluation. So depending on what we find and what the patient-centered goals are, we'll use specific exercises and activities and manual therapy to target those goals.
Very similarly, speech therapy, we sometimes will outsource different types of departments such as an ear, nose, and throat doctor visit, as well as different types of x-rays such as a modified barium swallow to get further testing to better dictate our goals of care.
Next question. Why choose Valley for outpatient rehabilitation care?
You should choose Valley for your outpatient rehabilitation care because we truly are a multidisciplinary team. It's not often you see speech, physical, and occupational therapy all under one roof at one clinic. Again, we always focus on evidence-based care, and we have multiple certifications to help patients with specialized needs.
We make sure that all of our care is focused on both the patient goals as well as the caregiver goals, and we focus our goals also on quality of life so the patient can get back to being home the way that they would like to be.
By focusing on patient and family-centered care, we provide great care for our patients here at Valley so that they can be independent members of the community.
Thank you all for these questions. For more information, please visit the link below.